In the cities of Bad Homburg and Usingen in the Hochtaunus district, history is currently in the making. For the first time in Germany, 2 new clinics are being established which are to be built and operated by private partners.
This is a unique project in Germany, a groundbreaking pilot project where the clinics being public institutions are utilizing the resulting investment possibilities.
A modern, future-oriented health campus is being set up. The medical infrastructure will be top-notch in order to secure medical services for the people of the district in the long term.
When compared to conventional project realization, the Hochtaunus clinics could save up to 210 million over a contractual period. This amount is convincing.
For the first time in Germany, we have a public-private partnership in the hospital sector, between a public hospital and a private partner who's responsible for the shell of the building.
Public-private partnership, a pilot project in Germany. A model with a private partner who is planning and building both clinics with financial support from the state of Hesse, and who will subsequently ensure their maintenance and technical operation over the next 25 years. The medical and nursing services, however, will remain in the hands of district-based Hochtaunuskliniken GmbH, who, being the initiator of the project, put together a team of qualified service providers. Arcadis was commissioned with the PPP project management and the technical consulting. Arcadis is an international provider of consulting, project management as well as planning services. The company employs more than 15,000 staff members worldwide in the areas of infrastructure, water, environment and real estate. Arcadis has the necessary expertise and know-how to support such a PPP project all the way from the tender and award procedure to construction, startup and operation. Planned run time for the entire PPP operation is 30 years. In the first 2 years, in 2009 and 2010, the main task of Arcadis was the preparation and implementation of the participation contest, the creation of all the technical tender documents, the definition of so-called service level agreements for the 25-year utilization phase, as well as the management of the contract award process, including numerous workshops with all involved parties for specifying the facility layout details. Project implementation has been in full swing since 2011. Construction is planned to begin in the summer of 2011. If everything goes as planned, operation will commence after only 2.5 years of construction. The actual operating agreement has a total runtime of 25 years. The PPP project started up with an ambitious timetable, which had to be adhered to in the overall contract award process and participation contest.
For us at Arcadis, the highly complex project organization, which is all taking place within the framework set by the tight, ambitious timetable agreed upon with the client, is surely one of the main challenges we're facing. Another factor worth mentioning is the high level of transparency for all decision-making procedures in all phases of the project, and we're happy to announce that, together with all the project participants, we successfully completed the first interim step in mid-February, the signing of the contracts for this extraordinary project, and are now seeing the development of what the hospital will actually look like once construction is complete.
It is not only the 2 new clinics in Usingen and Bad Homburg which are being built, but also a health campus with a medical center, dialysis center, parking garage, rescue station, and a building for inpatient medical services. Its own energy center supplies the facilities with heating and cooling and also offers backup power supply for the emergency ward.
In order to ensure a safe, economical yet highly efficient energy supply for the future, Arcadis Lifecycle Management has examined various options for the heating, cooling and emergency power supply for the future-oriented health campus in Bad Homburg. In the process, a local heating supply turned out to be the most economical solution. The heating network is to be planned, built and operated by a private partner, analogous to the PPP model. The energy will be supplied by the contractor, a company specializing in such services. The consumption of the hospital building is expected to be 20% below the levels required by German energy conservation regulations.
The economic analysis and consulting for the PPP model was carried out by Andre Consult in close cooperation with Arcadis. In their comparative analysis, which used a conventional hospital building, they came up with the following results.
The advantages of a PPP model for the Hochtaunus hospitals lies in the bundling of performance components for the planning, construction, financing and operation, which are all in the hands of a single private partner. Conventionally, these modules would have been assigned separately to different contractors. Each contracting company would receive its own remuneration and act independently. The PPP option, however, bundles the responsibility for costs and allocation of tasks. This creates maximum cost pressure. We are, therefore, all in the same boat. This means that even in the planning phase, it is ensured that the construction costs are kept to a minimum and the operating costs are optimized. Furthermore, the clinics also benefit because they can rely on cost stability for the entire contractual period. At the end, there is a building which, measured by its age, is in top condition and without any maintenance backlogs.
A feasibility study carried out by André Consult prior to the award of the contract shows that in comparison to conventional methods for realizing such a project, savings of up to 210 million euros in construction and operating costs can be expected over the 25-year contractual period. In the opinion of Hochtaunuskliniken GmbH, this was sufficient reason to decide in favor of a PPP project.
In the two locations in Bad Homburg and Usingen, which will have a total working area of 35,000 square meters, we are building two hospitals with a capacity of nearly 600 beds, as well as a private clinic, and in Bad Homburg, an outpatient surgical centre. For us, the PPP model does not only offer a clear head start, but also especially the possibility to construct and operate two hospital buildings for 25 years at a fixed price and without any cost risk, thereby permitting us to focus entirely on our core competencies. A special challenge has already come about in the project planning phase, in which various interest groups are participating and their requirements all have to be determined.
A challenge which Arcadis is confronted with on a daily basis. Therefore, experience, sensitivity and knowledge about possible risks and problems are absolutely necessary in order to avoid them right from the start.
For project realization purposes, it's necessary that we're familiar with the various interests of all participating parties, that we bring them together, use communication management to identify the individual topics of interest, simplify these and break them down to ensure that the respective decisions which are required can subsequently be made.
This also includes the contractual agreements with all participating parties, which were handled by the attorneys NER right from the start of the contract award procedure.
On the one hand, we have to ensure a legally secure award procedure, the determination of a transparent rule of procedure and the same information flow for all bidders to ensure a fair competitive framework. On the other hand, the contracts must be worked out and negotiated. They form the basis for a 25-year cooperation, which means the rules of the cooperation between hospital and partners for this period must be evident.
The PPP model is a pilot project for the funding of hospitals in the state of Hesse, as it is integrated into an alternative procurement option. In order to enable the funding approval of more than 70 million euros by the state of Hesse, certain fundamentals had to be established first.
The construction of the two hospitals will secure the medical care of the people of the district in the long run. Together with the state of Hesse, we found a way to involve private partners, financially as well as subsequently in the running of the hospitals. I'm quite sure that this will set a precedent, and if all prerequisites are met, construction will commence in the summer of 2011.